everyone. My name is Farida Thagafi, and I'm Associate Professor at the University of Tasmania, also Associate Head of a School, Learning and Teaching Postgraduate. So it's a pleasure to introduce our newly redesigned postgraduate nursing program. And it's a program that is built not just for today's nurses, but for tomorrow's healthcare leaders. In fact, this course represents a bold step forward. It's the result of extensive consultation with industry, educators, and professional bodies across Australia, and it directly responds to emerging challenges in healthcare, from the need for advanced skills as to the expansion of the nurse-led services. So it is designed to elevate your capability, your leadership, and clinical excellence across nursing specializations. So I'm going to go and start the presentation with the acknowledgement of country. We acknowledge the Palawa Pakana of Lutravita and the Gadigal people of Eora Nation, the traditional owners of land upon we live and work. We pay respects to elders past and present as the knowledge holders and sharers. We honour their strong culture and knowledges as vital to the self-determination, well-being and resilience of their communities. We stand for a future that profoundly respects and acknowledges Aboriginal perspectives, culture, language and history. So we have a packed hour to go through, and this is what we will cover. We talk about, first of all, of course, introducing our teams, why we're studying with us, and overview of our degrees and pathway and the structures, specializations that we offer. And they are on 3 levels of grad cert, diploma, and master degree. Also, specifically, we will talk about registered nurse prescribing pathway, which is very new. And of course, Health Partners HECS scholarship, important part related to the finance of it and how to apply and questions. First of all, I would like to introduce you to our head of the School of Nursing, Professor Christine Sterling, to say hello to you and introduce herself. Thank you, Christine.
Thanks very much, Farida, and welcome everybody. Thanks for joining us today. I'd just like to point out that the University of Tasmania is actually Australia's 4th oldest university, and within that, the School of Nursing really has a very long tradition of delivering innovative and high-quality postgraduate nursing programs. We've been reviewing these over the last 2 years, and really the whole point of this change in our offering is just to be future focused, because we know in the future that nurses are going to be increasingly leading in policy, research and interdisciplinary teams and care. So we're really excited. We've kept all the good bits of what we've been offering, and we've just really refined things. So I'll pass over to the team, but welcome, and I hope you find this really informative.
Thank you, Christine. Okay, so let's meet the rest of our team. So I would like to ask our course coordinators to perhaps say a quick hello, and we start with Annette Saunders, please.
Oh, hello. Thanks everybody for taking time to be here with us. I'm the course coordinator for the Graduate Certificate in Advanced Nursing, and I'm based in Tasmania.
Thank you, Annette. And Dinah McCann.
Hi, everyone. So I'm the course coordinator for the Graduate Diploma, and I'm also for the Graduate Certificate in Addiction Studies, and I'm also based in the lovely Launceston.
Thank you, Dinah. And Michael Jark.
Hi, I'm Michael Jakes. I'm course coordinator for the RN prescribing pathway, and I'm in Nipaluna, Hobart.
Fantastic, thank you. And Michelle Palamoda. I don't know if Michelle hears us.
I'm sorry, I didn't press unmute. My name is Michelle. I'm the course coordinator for the Master of Advanced Nursing. I am based in sunny Brisbane, Queensland.
Fantastic. Thank you, Michelle. And the rest of the team. Now we're going to meet all our specialization leads, something that we are very proud on, as you don't see that in many other universities, that every specialization has an expert looking after it and oversee the curriculum and progress of it. So I might ask quickly to people introduce themselves based on what you see in the screen. If Joe is around, and say hello quickly.
Hi everyone, lovely to meet you. And I'm based in Central Victoria, so I work remotely and I look after the acute care and high acuity streams.
Thank you, Joe. Can I ask people just come on board so I don't call who is around? So if we go from the left to the right and just say hello and introduce yourself, and we'll move to the next person. So Richard is the next.
Yeah, that'll be me. Lovely to meet you, everyone. My name's Richard Say, and I am the lead of the clinical teaching stream, and I'm based in Sydney.
Thank you, Richard.
Hi everyone, my name is Sharon Andrews. I'm one of the associate professors in nursing. I lead the gerontological nursing stream and I'm also based in Sydney.
Fantastic, thank you.
Hi everyone, I'm Greg Gordon. I'm the specialty lead for addiction studies and I'm based in Western Australia.
Fantastic. And we hear all that we got people from across Australia. That's fantastic. Our experts coming from every state, which brings different expertise with them. I believe Amali is on, thank you, Gordon, on leave. So we pass to Professor Melanie Greenwood.
Hello there, as I've said, Melanie, and I teach the Leadership in Practice specialisation.
Thank you. Jackie, I don't know if Jackie is around.
Hi, it's Jackie Colgan. I'm the cardiovascular nursing lead and I'm based in New South Wales.
Thank you. Alison. She might not be online. So then Denise is the next.
Hi there, everyone. I'm Denise McGarry. I am based in Sydney and I'm the lead for mental health nursing. Thank you.
Thank you. Shona.
Hi, I'm Shona. I'm the lead for Child and Family Health and I'm based up north Tasmania.
Thank you. I don't know if Ben is around.
No, Ben and Alison are both working clinically.
Okay, and Nicole.
Thank you. My name's Nicole Friends and I am the neonatal specialisation lead and I'm joining you from Southeast Queensland.
Fantastic. So, Kelly. And if Kelly's not around, Sarah.
Hello, Sarah Carasoni from the Roselle campus in Sydney. Hello, everybody.
And Sarah is looking after our newest specialisation, palliative care. Very excited about that.
I forgot to say that. Thank you.
And Associate Professor Peter Van Dam. You got mute on, Peter.
Sorry. Hello, everyone. My name is Peter Van Dam, and I'm the lead for quality and safety, and I'm based in Hobart, Tasmania.
Thank you, Peter. And Carly.
Hello, everyone. I'm Carly. I'm the oncology nursing stream lead. I'm based in Mackay, Queensland.
Thank you. James.
Hi, everyone. My name is James, and I am the peri-anesthesia speciality lead, and I'm based in Sydney.
Thank you. And Deb?
Hi, I'm Deb. I can't turn my video on. I'm so sorry. I'm I'm the unit coordinator for the renal course, and I am based in Adelaide.
Thank you very much. And Fiona.
Hi, I'm Fiona Newman and I'm the specialty lead for perioperative nursing and I'm based in Brisbane, Queensland.
Thank you. And Dana. And mute on.
Popping on and off. I'm Diana Gutierrez. I am the primary healthcare lead and I'm based in beautiful Burnie, Tasmania.
Thank you very much. So, the reason for introducing our team is you see the vast number of specialization that you could choose from, the expertise that team brings together. That's one of the uniqueness of our courses, obviously. And leads are available for question and answer afterward. I believe you can register to get one-to-one or a small group asking question from specialization leads. So the next important thing is, why would you want to study with University of Tasmania? So there are some good reasons for that. We can't give a whole list, but we can just focus on 3. So one of the important part is about the student rated teaching excellence. So as part of our quality activity, every semester we ask students to give us feedback about how they perceive the course and their learning and the quality of material and teachers. So based on that, we know that we do very well. We have 95% satisfaction in the different various indicators in our student experience. Also at the national level, we are above other universities, and those surveys are done externally, so there's no bias there, obviously. The other important factors is about unmatched choice and flexibility. Especially with the new design, we will have in the level of graduate diploma, for example, you have over 30 units to build your own graduate diploma based on the specialization you want to develop through and get a qualification from. So that is absolutely flexibility there. Also, the number of specialization, as you just met some of our specialization lead, that's very impressive. And third is about the scholarship for partner employees, which is in comparison with any other institute is absolutely attractive. So I already touched base on this. Student experience survey results an important indicator for us for the quality and monitoring of our courses. So these numbers you see here, they are from last national survey that was done across Australia. And this is our results. So these are done by external institutes, not by us. So that's true, accurate information that comes without any bias whatsoever. So 90% satisfaction overall experience of the students in postgraduate courses. So in this university, in this school of nursing, which is impressive. Also, we had 95.3% satisfaction with teaching quality. So that teaching quality is specifically related to the lecturers, tutors that they work with the students, and also learning resources that they are available mainly online through our Milo, which is a learning platform. And of course, the students also stated that they had satisfaction with skills development because our course is so focused on what is important to the real world practice, what is important to a person who graduates from a graduate certificate or diploma or master, what the industry wants, what the healthcare needs are, and that's how we tailor our courses. Okay, so I'd like to now introduce to you the structure of the course, and you can see the level of complexity there, which means how we fine-tune everything to be able to develop various pathways for our students so they can choose the right pathway based on the units they select for their study. If they want to go for a job in a higher level, if they want to advance their scope of practice, or they want to be a researcher. So it's all tailored nicely based on what we expect people would like to do, based on all those background work we've done with the consultation with the partners, with the former students, etc. So this is overall structure of the course. You can see in 2026 will be delivered. So graduate certificate level, advanced nursing, you can see that on the left side with the over 20 specializations in there, and palliative care is the brand new one, will be delivered for the first time next year. In the middle, we've got the graduate diploma of advanced nursing with the specializations, which if you have done it in the grad cert, you continue that in the diploma. You have 3 pathways to choose from, nursing coursework pathway or research pathway, or the new one under the accreditation assessment right now is RN prescribing pathway. So we are one of the very few universities that they are going through this assessment by Australian Nursing Midwifery Accreditation Council. We're very proud of the progress we made and the curriculum that is built. So that will be delivered next year. And a Master of Advanced Nursing, obviously, that is articulating from the graduate diploma with the same pathways in the graduate. You have coursework or research or advanced practice pathway. So obviously there are 3 different levels of degrees, and you may think, well, you're in the right place, obviously, first, because you're thinking of your continuing your study, but maybe you're not sure which level you should go to. Should I go for graduate certificate or diploma? Or I already got a graduate diploma, do I continue to the master level, or maybe I should go for a different specialization? So obviously there are important questions to think about as you are spending time and energy and money. You want to be in the right direction. So this is some little hints for you to think about what would be the most appropriate study pathway and degree to go for. So graduate certificate level, it's about being specialized in that particular clinical specialties. So I guess in many institute and hospital settings, you would see that would be part of going for a clinical nurse specialist, a CNS position, for example, or you're just interested to be able to provide a better quality care for your patient and you want to know more. If you're working in critical care, in ICU, you want to be able to look after your patient better. So then, of course, then you choose the graduate certificate in advanced nursing, that specialization, and that's the first step towards further study. Now, when we think about graduate diploma and the master, obviously you're thinking a bit further than looking after this many patients that you've been assigned to. You're thinking about how you can contribute to more holistic, a bigger picture. You might want to be an educator, you want to be a nurse unit manager, or working for the quality and risk, or whatever other reasons they are. Or you want to change the scope of practice. You want to be RN prescriber, or you're thinking about you want to be working towards nurse practitioner. So that's the right thing to do as a first step. And then we get the master level, you are looking much bigger picture. Now you're contributing to the discipline, you're contributing at the policy level, at the governance level, and you could be a manager, or you're thinking about senior educator, etc. Or you want to go towards your PhD, which then you will have the options of those 3 pathways to choose from. So it's an important question and needs a lot of thinking, and we are happy to assist you to choose the right pathway. So this is I think that's, I have to pass this to Annette, starting talking about the graduate certificate in advanced nursing.
Thank you, Farida. So as you can see on the left-hand side there, oh no, we're moving on to the next one. No, that's okay, we can move across. We've had a look at those specialisations and I'll talk more to those if you want to go to the next one step. So if you are, so as a registered nurse who is registered with AHPRA and has no restrictions or conditions, if you've been working for at least 6 months full-time as a registered nurse, then you're eligible to enrol in a graduate certificate in advanced nursing and choose from one of those specialisations. Keep in mind that it is really flexible. It's fully online. Except for child and family health, and Shona will be very happy to talk to you about that. We offer that at the moment in New South Wales and Tasmania, and there's a PEP placement element there. But in the graduate certificate, we often have people who just want to do the graduate certificate in 1 year, so they do 2 units in semester 1 and 2 units in semester 2. Others decide that they want to do it over a longer period of time, and they can take up to 3 years. So some students also enrol in 2 units in the first semester and then weigh up whether they can manage 2 units and work and family and everything else that you have to deal with. And you're very welcome to withdraw from one of those units and just continue with 1 as long as you withdraw before census date, and that's around about week 4, but we certainly give you a lot of notice about that. We might move to the next one. So here's our list of specialisations within the graduate certificate. There's some stars there that you'll see, and those ones are specialisations where you have to there's only a semester 1 enrolment. So there's very foundational semester 1 units that you need that knowledge and to have applied that knowledge and skill before you move into the more advanced units. So within that, there's critical care nursing, and just be mindful in a lot of these specialisations, you need to be working at least 2 days a week in that specialisation. So critical care nursing, you need to be working in an intensive care unit at least 2 days a week, because you really will be applying knowledge, your knowledge and skills, and developing that expertise, and you need to be working in that area. For emergency nursing, you need to be working in an emergency nursing unit. So these aren't set up for people who want to work in critical care or emergency. You really need to be working in there. And I really recommend that you're there for at least 6 months, because that first 6 months in a specialisation, you've got, it's really busy, a really high cognitive load, learning about that specialisation, and then you can build on it with your graduate certificate. So perioperative nursing is also a semester 1 entry, and that is specific to peri-op. So that's for any of you who are working in scrub scout area, and we have a separate specialisation for peri-anaesthesia for those of you in anaesthetics or PACU. Now there's a number of specialisations there where you just need to be caring for a person who has that condition. So neuroscience nursing, for example, we have people who are working in a neuroscience high dependency unit, also people who are working in a rehabilitation unit looking after stroke patients and people with acquired brain injuries. So I guess without going into specifics about each of those specialisations, please contact either myself or one of the specialisation leads, and they can let you know. Well, they can have a discussion with you about what is best place for you, for what your interests are and what your career aspirations are. I think we've got pretty much enough specialisations there to meet all of your needs. We move to the next specialisation. the next specialisation, the next slide. One thing I would say is that we are incredibly student-centred, and we're really proud of that within the School of Nursing postgraduate suite of courses. So all we ask is, if you're having any trouble, please reach out, because we have so much support available. But we need to know if you're struggling in any way, shape or form, so we can actually direct you to the people who can assist you with that support, because we want to produce the best nurses in the specialisations that they're enrolled in. Is there another slide there, sir? So now I'll hand over to Dinah McCann.
Thanks, Annette. So I'm going to talk to you about the graduate diploma, which is sitting there, and we might just move. Thank you. So the graduate diploma, like the graduate certificate, is a fully online course. The same consideration applies to child and family health. So you can do a graduate certificate and complete your graduate certificate, take some time away, and then come back to do a graduate diploma. And if you're doing it within the same specialisation, then you get credit for the units that you've done in your graduate certificate, and you can continue on in the graduate diploma units. Or you can enrol directly into a graduate diploma. So the graduate diploma is 8 units in total, and you can do it over 2 years, because it is a part-time course, or you can have up to 5 years to complete it. So if you're doing 2 units per semester, it will take you 2 years. And that's if you're enrolling directly into the graduate diploma and doing those 8 units. You need to have the requirements are the same. So you have to have practiced for a registered nurse for at least 6 months full-time equivalent since graduating from a university program. And you need to provide evidence of your APRA registration. There's 3 pathways, as Farida was showing us earlier, in the graduate diploma, and so I just want to spend a little time considering, why would you choose particular pathways? And the nursing coursework pathway, this is really the most flexible pathway, and this is the pathway that provides you with the opportunity to build your capabilities. So you will have studied your specialty units at the graduate certificate level, those graduate certificate specialty units, which are included within the graduate diploma, and then you're choosing from core optional units that you can use to improve your capabilities and your knowledge and skills within your specialty area and more broadly within nursing. If you're looking at the nursing research pathway, this is particularly designed for nurses who think that they would like to be advancing a career in research. So research skills are great for any nurse to have. But if you're thinking that research is actually the career pathway you think you'd like to be taking, and you might want to go on to do a PhD, then the nursing research pathway is the pathway for you to choose to follow through in that direction. And then the RN prescribing pathway is for students who would want to be able to apply for endorsement as a registered nurse prescriber at the graduate diploma level. And it's also the pathway that you would want to be on to meet educational requirements for nurse practitioner after completion of a master's. Just noting that this is all about getting the educational requirements, but it's up to you to ensure that you meet all the MBA requirements for endorsement as an RN prescriber. So this is what it looks like in the different pathways. So bearing in mind that the graduate diploma is 8 units in total, that's 100 credit points. 4 of those units are the specialisation units from the graduate certificate. So if, for example, you had chosen to do a emergency specialisation, then you need to do the core units for the emergency specialisation. You then also need to do CNA 672, Evidence Informed Practice. That is a core unit for all of the pathways in the graduate diploma. And in the nursing coursework pathway, you would choose 3 core option units, and I'll talk a little bit more about those in a moment. If you're doing the nursing research pathway, again, you've done your specialisation units. You're again doing research informed practice, and you have another core unit, which is CAM 720. So that's health research methods. This is starting the pathway for you learning how to be a researcher, not just about using research in your practice. So evidence-informed practice is really for all nurses to understand how to use evidence effectively in their practice, which is why it's a core unit for all nurses. The health research methods unit, that's a unit that is starting you on the journey of learning how to be a researcher and create the research that that underpins our practice. And then you have 2 core option units. And then the RN prescribing pathway. So this is the least flexible pathway because of accreditation requirements. And so you have 4 core units. And Michael will talk a bit more about that. One of the things that is really a positive, I think, for students in this advanced nursing course that we're offering is the very large number of core option units that are available in the graduate diploma. What this enables you to do is really have choice. So depending which pathway you choose, but if we talk about the coursework pathway, for example, you have the option of choosing 3 core option units. So you can choose to focus on units that are very clinically focused. For example, you may have been doing the emergency specialisation, you've done your specialisation units in emergency, and you want to expand your skills and knowledge around wound management or pain assessment. And so you're choosing very clinically focused units. You could be looking at advancing your health assessment skills, being more confident caring for a deteriorating patient. You may want to have a better understanding of the violence that underpins the reasons for people presenting to your trauma unit, or a better understanding that the violence that you're encountering in your workplace. So violence and health might be something that you choose. But you also can see whether other areas of nursing might be something you're interested in. You could do a unit in quality, around quality improvement if you think that that's something that you might be interested in doing. You might want to look at healthcare in remote and extreme environments. You might have been doing a paediatric units, but you'd like to do one unit that explored things in an adult setting. So you have a really wide range of units to choose from, spread across the 2 semesters. And I'll pass over to Michael to explain the nurse prescribing pathway.
Thanks, Diane. It's really an exciting time for, I think, all nurses and the nursing profession broadly, with the integration of the RN prescribing into nursing practice. UTAS has an RN prescribing course that will enable, I think, the trailblazers amongst us to develop new models of care and really innovate the future of the nursing profession. And I think this pathway will also be helpful if you're applying for roles and give you that professional edge. Our team is going to pop some links in the chat if they haven't already. I'd grab them now just because once the webinar finishes, you'll lose them. But one of them is a reference to the ANMAC endorsement process, and the other is to our UTAS graduate diploma overview. So it'll give you a bit of a more content than I'm going to give you in this next little bit. But I guess moving on to the endorsement process. So it is an accredited entry into prescribing as a registered nurse. Our course is under assessment at the moment. We should find out hopefully later on this year whether we've been successful or not. you will need to meet all the requirements for endorsement. So as a quick sort of snapshot, you need to be a registered nurse, you need to have 5,000 hours of practice in the last 6 years, no conditions on your registration, and then you need to have successfully completed an accredited course. You'll, I guess, at the conclusion of that, you can apply for endorsement, and then you'll need to undertake a 6-month sort of experience with a authorized health practitioner to really develop those skills and confidence required for safe prescribing. So what does our course look like? You can see it on your screen there. We've got 4 units in the graduate diploma. The first one being CNA 672, which is across all of the pathways, but it's essentially the evidence-based to inform good decisions in practice. We've got CSA 524, which is the medication principles for advanced nursing and midwifery, which is the pharmacological foundations that underpin prescribing and why we prescribe and what medicines work where. CNA 533, which is really the health assessments required to, well, hopefully you'll develop and grow your assessment skills, but also use them in safe prescribing practices. And then CNA 608, which is the capstone unit for the RN prescribing pathway, where you'll put it all together and essentially get to practice, I guess, the art of prescribing against lots of the legislation and against quality use of medicines in a mix of settings. And I guess why is this particular pathway better than any of the others that might be posed across the country? Well, the online delivery is always pretty handy because you can access it pretty well. We've got a lot of real world scenarios because it's taught by practicing authorized health practitioners like myself as a nurse practitioner. So you're going to get real world scenarios with current level advice. Going to be a bit of a telemarketer now and pump the course, but there's only 150 spots under next year's sort of offering. So get in quick, have a chat to our UConnect team, and hope to see you all in 2026. I'll hand over now to Michelle Paliwoda, who will discuss an overview of the master's preparations.
Wonderful. Thank you, Michael. So hello, my name is Michelle. So far, you have learned of the graduate certificate, graduate diploma, and the nurse prescriber programs. I'd like to take a moment, though, to introduce you to the Master of Advanced Nursing course and highlight what you can expect. But in the meantime, if you have any questions related to specific courses, I encourage you to ask the specialisation leads in the Q&A box, and they'll be able to answer those. So similar to the graduate diploma, our master's program offers 3 specialised pathways, with each designed to support your professional growth and help you advance your nursing career in a direction that best suits your goals. Now, this may be whether you're seeking a leadership role, prescribing endorsement, or perhaps developing your research skills to further evidence-based practice. But in either pathway, by the end of our master's course, you'll be equipped to lead, influence, and transform nursing practices, all within your specialisation. Now, the first pathway is coursework. This pathway is suited for those who prefer a structured, advanced learning experience, and it focuses on professional development. It is an excellent choice for those who are looking to advance their career, develop new skills, and change areas of practice, or even gain specialised knowledge required for more senior professional roles. Now, in this pathway, you will complete 3 additional units, 2 of which are core options, or previously known as electives, which I'll talk a little bit later on, and 1 capstone unit. Now, this brings together all your learning together in a practical and meaningful way. Now, the second pathway is the research pathway. This pathway is specifically designed for those who want to pursue a career in academia or high-level research, or even ways to contribute to new and original knowledge, especially in your specialty area. And it allows you to undertake more independent and focused, I guess, study or exploration on a single topic. Now, our research pathway will provide you with a strong foundation to advance further in our course and provide you with the stepping stone to undertake a PhD. Now, the third option is the advanced practice pathway. This pathway is specifically tailored for nurses who are ready to extend their clinical expertise and take on a greater scope in their practice. This pathway is intentionally structured and is highly prescriptive. And as you can see there, it has the 3 set units. Now, this helps you meet some of the stringent requirements of AHPRA, or the NNBA, Nurse Prescribing Endorsement Pathway 2, thereby providing a clear and supportive route toward expanding your clinical authority. Now, if I can go back to the admission process, so I can tell that you are all ready to press the apply button, which is really great. But I just want to bring a few important points to your attention. Now, our master's program has entry requirements, just like every other university. So first, you at least have to have a graduate diploma or equivalent with a credit grade average, which is equivalent to approximately a GPA of 5. And you need to have this in the same specialisation. And you also need to have at least 6 months full-time equivalent nursing experience since graduation, along with a CV and also evidence of employment. Now, I'd like to reiterate that this course is delivered fully online and part-time, so you're able to undertake the course requirements while juggling work and family. Therefore, you can undertake this unit in the comfort of your home and even in your pajamas. So the coursework pathway allows you flexibility to select 2 core option units. The nursing research pathway, 1, and as I alluded to before, the nurse prescribing pathway is quite prescriptive. If I can jump to the course option slide. So course units that begin with CAM are delivered by the School of Medicine. Those that are CAA are delivered by the School of Paramedicine. Now, I can speak personally of the value of CNA 812, as I've been closely involved with this unit. So in CNA 812, this one offers you a rich learning experience that builds advanced nursing knowledge and strengthens your ability to apply evidence-informed practice in real-world settings. These are very important skills. And in this unit, you will learn about nurse leadership and how leaders' traits and characteristics impact the ability to make practice change in nursing. You'll also learn about clinical governance, conference abstract writings, and conference presentation. Now, if you master these, it may give you the opportunity to present locally, nationally, or even internationally. Our capstone unit, CNA 803, is a double-weighted unit. So that means it's worth 25 credit points. This capstone unit offers you the flexibility to choose topics that align with your clinical area of expertise and allows you to complete a literature review, develop a practice change proposal, and prepare a manuscript suitable for potential publication. So through these units, you'll build advanced skills in clinical analysis, scholarly writing, and evidence-based practice, and skills that can significantly propel your nursing career forward and prepare you for leadership or advanced professional roles. So I encourage you, should you have any questions or concerns regarding the core option units, feel free to type these in the chat and one of my colleagues will be able to respond to these. So now you can press apply. I'd like to hand over to Michelle.
Thank you, Michelle.
Hi everyone, thank you for joining with us. We've almost made it to the end, and please keep those questions coming. We're busy working in the background to answer those effectively and efficiently as we can. So my role is Director of Health Partnerships at the University of Tasmania, and I'm going to be talking about the partner HEC scholarships that are available to our partner organisations. So fees are very important when it comes to or the cost of courses is very important when it comes to making your choice. And our courses, right through to the masters, are available under a Commonwealth supported place. In addition to that, through our partnership network, you can access some scholarships for the course costs, depending on the organisation that you work for. So I'd encourage you to use the QR code or use the chat link and search to see if your employer is part of our partnership network. This has been a really important component of the School of Nursing's development of this course and the changes of these courses, because we've used this partner network to inform those changes. In relation to a Commonwealth supported place, very common word for us to use at the university, but a Commonwealth supported place is available for Australian residents, permanent residents, or New Zealand citizens residing in Australia for the duration of your study. And if you're not sure about whether you fit under that category, you can just Google CSP or Commonwealth supported place, and the definition and guidelines will come up nice and clear for you there. When you apply, and I know Michelle's just said you're all ready to apply, so I think you're probably halfway there by now, we'll get you to complete a health employee declaration form. So I'll go back to thanks, Steph, a health employees declaration form. And what you'll do on that form is identify the partner that you work with and the location of that workplace. That's our way of you highlighting that you're a partner, and our fees team will go ahead and apply that tuition fee waiver to your account. That list is reconciled, so the details are checked with our partner organisations just to make sure that everything is above board. And it's really helpful when you're filling out that form just to make sure you've got your details correct, because that really helps us with our reporting and knowing what numbers we have from each of our partner organisations. So now that you're ready to apply, well, you've clicked that apply button, you do that all online. So it's a very straightforward online form. We haven't got any trick questions in there. We do a bit of a dance back and forth in the application to enrolment process. So you apply online, we assess your application. We make you an offer, you accept that offer, and then we come back to you with your login details ready to enrol in the units that the team has discussed today. If you need any help with that process and selecting your units, you're very welcome to make contact with us, and we'll provide those details of how to do that in our follow-up email. So with that online form, you can see under that red line there are a few tabs to go through. So it will succinctly work you through as you provide the details required. We will ask you to provide your qualification, who awarded it and the year that it was awarded. And a very important component, which is an entry requirement into the degree, is your APRA registration. So you'll need to upload that information there. And if you're not sure of what your number is, you can always go to the APRA website to find that out. We've got some important dates. So applications are open now and they close for semester 1 next year by the 20th of February. I would encourage you, if you are wanting to start in semester 1, which commences on Monday, the 23rd of February, that you get in and you apply straight away. That way we've done that little dance of apply, offer and accept back and forth, and you're ready to go on that first day of semester with your login details. If you leave it to that last minute, it will take a little bit of time to process and semester would have already started. Our semester 1 census date is the 17th of March and the semester ends after 12 weeks on the 14th of June. And then we start again with second semester 2026. I know you've probably got many questions from today's webinar, and you might have some specific questions for our specialisation leads. So we're going to follow up with you after this webinar with an email and invite you to join a drop-in session where you can speak one-on-one or in a group setting with our specialisation leads and ask any of those really detailed questions that you might have regarding the specialisation or your choice of units that you might do if you're deciding to do one unit at a time, or individual guidance on the pathway that best suits your needs. We really want to make sure that we answer all your questions and that you're dedicating your time and your effort into postgraduate study in a way that is going to best suit your needs. So we will provide those in a webinar, and I think they might even, in an email. I think the invite might also, or the links to register will be available in the chat too for you to connect with us.
Just to confirm, Michelle, I have posted it in the chat, so if anyone would like to, they can register now. It is the last link that's there in the chat function.
Thanks, Lara. So now we have the opportunity to ask some additional questions that may not have been covered in the Q&A. And if you're wanting to have a question answered live, you're very welcome to get in and start typing now, and I will facilitate this discussion. Farida, do you want to pop off mute and...
Yes, sure. I am answering questions through the Q&A section, which is great. There are lots of questions, and I see that there are lots of interest in especially two areas. One is people who have completed a degree with another education providers, and they would like now to study with us, which is fantastic. And they ask about how this is going to work. We are very student-centric in this university. We do everything possible to make the study as smooth as possible, and we understand that our clinicians are working in rosters and shift and family, etc. So we do our best to accommodate and recognize what you already have studied. So if you have studied with us in grad cert, that is easy. If you are in the same specialization, usually in 90% of occasions, you would go straight to the year 2 at a graduate diploma, because we recognize that part. If you have studied with other institutions, that is fine as well, but that will be a case by case situation. There is a process that you put an application for recognition of prior learning. You put the unit outlines that you of the completed course with your transcript and qualifications, and they will be assessed. So we're looking at the same learning outcomes, same kind of assessment task. Then we recognize what you've done. You get credit for those units. It means be exempted from your course structure, and then you pick whatever is left. So that it seems quite a bit of question about that. The other question is about RN prescribing pathway. We already had our site visit. We are gone through the process of accreditation, and by December we will hear from NMBA, Nursing Midwifery Board of Australia, that the course is approved. That's what we expect to happen, but we don't know until we are there. So that will happen in December, which is very timely and fantastic for the start in February, because RN prescriber, it will be the best to start in February. The way the units are sitting, that's the best way to do, but you can start semester 2 as well. So that's another question pops up again there.
Can I jump in there? Can I jump in on the prescriber, Farida?
Yeah.
Just to let you know that the partner scholarships, if you're eligible for a partner scholarship, that covers the graduate certificate and the graduate diploma units, including the nurse prescriber pathway. So that is available for both of those. Someone else was asking whether there was, if you had to remain at the same organisation while you were studying. You can change organisations, but you just need to let us know that change and redo your health declaration form and identify your new organisation that you're working for. And you're not required to pay for that the fee up front with that tuition fee waiver. You can defer that as a HECS deferred payment. Even though you have that scholarship. So that scholarship is the amount's removed, and then you can defer the remainder of that payment if that suits your finances. You can, Frida, can you just confirm, oh, sorry, if you're working part-time for an organisation, yes, you are still eligible to apply for that scholarship. However, Farida, you might want to add just a reminder on how part-time is suitable to achieve the requirements of the degree.
0.5. So we ask for a minimum 0.5 so you can develop those capabilities that is required for any of those, especially practice units. So 0.5 is part of the admission requirement.
I have another question for you. As the RN prescribing pathway is new, someone online is just wondering if you could give a bit of insight into what kind of settings these skills would be used in.
So I might ask Michael to answer that question. As a nurse practitioner who is going to look after the course, he's in a good position to answer that.
Yeah, I think I've had a bit of a think about this as well, and I think the sky's the limit. It really is up to the individual organisations that you work for to really drive the change. But I think the people that undertake this pathway and start stretching the boundaries within their own organisational units, they'll be the driving force for change. So I guess the question I could throw back at the audience and say, well, where do you want to take it? Like with anything that's new, like the MPs out there, we've been around for 25 years, but we're still a very small component of the overall nursing workforce. So this will be slow to change and slow to develop. But if you get in now, you're going to be part of that innovative change that's going to transform the nursing profession. It's really exciting. Yeah.
Thanks, Michael. So I might add to that as well that the main purpose is based on what the organization wants. So it gives you extra scope of practice to be able to work on the supervision of an autonomous health practitioner to prescribe. So if you work in a GP clinic, that could be the case. If you're working in a gerontology, residential aged care, if you're working in a rural area, but also if you're working in a tertiary hospital, that would be work that releases a medical officer from other things they do, so you can look after the prescribing in that scope of practice that is being framed for this position. It is important to also know that your clinical governance at your hospital, director of nursing, they are important people to be engaged in the conversation. As we have talked with health partners about this, and in our conversation with the ANMAC, we know that this is very much driven by the organisation. So if you have intention to study in RN prescribing pathway, it is important to talk to your director of nursing to see if the support is available for you, because beside this study period, you have 6 months afterward in the internship supervision. So you need to have that support. So it's good to think about it before starting the study.
There have been a few questions about whether you need to do a grad dip before you do a master's, or can I go straight into a master's? Do you just want to just recap on the requirements around that, please?
So we have our master's degree is a bit different in the start compared to the others, because we start from graduate diploma. So you have to have a graduate diploma already, and then you enter to the master to finish the last year of your studies. So then it means the admission requirements is having RN with no condition, but also having a graduate diploma with the the grade average point of credit. So that's another important part. So you definitely need to have good marks in a grad diploma level and previous study to be able to be admitted to the course. And it's in the same specialization because it's a nested course. So if you are in gerontology in a grad cert, you are going to continue that way. However, some people want to finish one grad cert and then start a new specialization. That's possible too. But it works better if you continue the same here.
I'm glad you mentioned that because someone loved their first course so much they want to come back and do another graduate certificate and were wondering whether they could get the scholarship. And yes, you can. So you're welcome to come back and study again. Often that's quite common, isn't it, Farida? You know, people will do something and then they'll think, well, I've changed specializations or I'd like something, some qualification in another area.
Yes, that happens multiple times, and Dinah, as the graduate diploma course coordinator, can confirm that so many times people coming back and start a new graduate diploma, isn't it, Dinah?
Yes, they do. And what I always recommend, if you are doing that, and particularly if you have studied elsewhere, or if you have, but if you've studied with us as well, that we do try and give recognition of prior learning where we can, and so we do try and give credit. So there is a limit to how much credit you can get. But if you have studied units that are, for example, core option units in the graduate diploma, then it may be that you may get some units of credit for your second graduate diploma. Yes, so sometimes you don't have to do the full 8 units in your second one. We can give you a little bit of credit for that.
So we've been overwhelmed with questions and we've been working our way through them. We do have those questions and your names attached. So if we haven't been able to answer that question in today's webinar, we will follow up with you after this session. We truly appreciate your time this afternoon and for joining us online. And we look forward to meeting with you again with the specialisation leads. If you have any questions, don't hesitate to contact us and we'll follow up with that email, the invitation links, recording of the webinar and contact details for you to reach out. Thank you very much for joining us this afternoon and thanks to the team for all the information you've provided. It's really exciting.
Thank you. Have a good afternoon, everyone.